BASIC, which stands for Brain Attack Surveillance in Corpus Christi, is a stroke research study that's been going on in Corpus for several years. We interview people in the community with stroke symptoms so that we can learn more about this disease. We're looking for more community members to be part of the project. Here are a few of our participants and their families, as well as researchers and local doctors to tell you more about it.
My name is Nelda Garcia, and I'm the director of the BASIC Project Field Office here in Corpus Christi. We've actually completed over 5,000 patient interviews, and it's because of their participation that this project has become so successful.
We are proud that BASIC is now known throughout the world, and we are so happy about the tremendous knowledge that the people of Corpus Christi have given to the world about stroke.
I began the study in January of 2000 because I wanted to reduce all the bad things that happen when people have a stroke. I also really liked Corpus Christi and knew that the medical care in Corpus was first-rate. The people are friendly and the community works together to help each other.
The BASIC project is funded by the National Institutes of Health, a federal agency that is helping us to learn more about the devastating effects of stroke. Together with you, we have helped doctors, public health researchers, and planners learn more about the risk factors for stroke and how to prevent and treat this disease.
The doctors and hospitals in Corpus agreed the study was important, and we have worked really closely together ever since.
We're looking at very valuable data, hopefully at long-term information regarding stroke outcomes and the treatment of stroke, which could be very important to those patients and their families in the future.
Participation in the study by the patient, what it involves is a brief, about 30-minute baseline interview, and then we do follow-up interviews at 3, 6, and 12 months. Those interviews might last a little longer, perhaps about 45 minutes. We do them at the convenience and scheduling of the patient, their home setting, or they can come by the office, whatever works best for them.
The most important part of BASIC are the participants. Here are a few of them to tell you about their experience.
It is important to be part of the BASIC study because it does, number one, and I'm adamant about this, it's educational for the person.
They kind of asked simple questions. They didn't go very technical into it, you know. You just try to ask me questions that, you know, might, like, how did you feel after, or, you know, how was my speech, my eyesight, my reflexes.
I kind of encouraged him to do it. I kind of felt like anything that we would find out for him, for his sake, and for the research's sake, and for someone else, I thought that was, you know, that was wonderful.
There was really no reason then that I should not help.
One of the most exciting parts of BASIC is studying about how sleep apnea relates to stroke.
The sleep apnea screening is actually a one-night screening where the patient wears a portable device. It's just simply a belt, a simple belt over their chest, a nasal cannula, and a pulse oximeter.
You're comfortable in your own home, and you can find out if you have a bit of sleep apnea or whatever.
Although we have been working in the community since 2000, we have so much more to study.
It's great to participate in the study to help someone else.
Thank you for your interest in this important research. With your participation, you can help us learn more about stroke and how to prevent and treat this disease.